Most women over 40 don't need a cabinet full of powders. They need enough protein, plants and fiber, healthy fats, strength training, sleep and stress support, and then supplements fill gaps, not replace meals. So this is what a solid diet looks like. You want protein at every meal. 25 to 40 grams is great. It's a great target for women. Chicken, fish, Greek yogurt, cottage cheese, lean beef. You want 2 to 3 cups of colorful produce daily. Also want to get 25 to 35 grams of fiber. You get that from berries, beans, lentils, chia, flax. You also want to make sure you're getting healthy fats daily. Olive oil, avocado, nuts, seeds, fatty fish. Focus on calcium-rich foods because bones matter more when you're 40 plus. So you want yogurt, cottage cheese, fortified milks, sardines, tofu set with calcium, leafy greens. Do I need a daily vitamin? And the answer is usually no, not if you eat well. So some exceptions, which are common ones, is a very restrictive diet, diagnosed deficiencies, bariatric surgery. The core supplements that are usually worth it for most women 40 plus, if you want a simple starting lineup, start with vitamin D3. It helps with mood, your immune system, your muscles. It supports bone density and fracture prevention, especially when estrogen declines. It plays a role in muscle function and immunity. Many women are low, especially in the winter. How you're going to take vitamin D3 is with a meal that has fat, because it's a fat-soluble vitamin. And some typical common ranges is 1,000 to 2,000 international units daily. If your labs show that you're low, your doctor may recommend higher dosing short term. Second supplement is magnesium. It helps with sleep, stress, muscle recovery, bowel regularity, and why it matters is it helps with sleep quality, relaxation, muscle cramps, and tension. It can support constipation depending on the form that you're going to be taking, but most women don't get enough from food. Usually the best form that is well tolerated is magnesium glycinate. It's best to take it at night, starting with a low dosaging of 200 milligrams, and then just adjust based on your sleep, digestion, and your tolerance. You should usually take a vitamin D with magnesium. They don't have to be taken at the same time, but they work well as a combination because magnesium is involved in vitamin D metabolism, and many people are low in both. So you want to try to take vitamin D3 with a meal or whenever you can remember. Magnesium should be taken at night. That routine is easy and it's consistent. I take everything at night because that's when I can best remember. If you're someone who has kidney disease, magnesium supplementation should be medically guided. The third supplement is omega-3 fatty acid. It helps with inflammation and heart and brain health. If you can get this through food, obviously first, that's the best way to get it. You should be having fatty fish twice a week, salmon, sardines, trout. I personally despise fish, so I have to supplement. You want to look for a third-party tested fish oil. A practical target many clinicians use is around 1 to 2 grams combined EPA and DHA per day. I want you to make sure you check the label. If you're on a blood thinner or you have a bleeding disorder, you need to make sure you check this out with your doctor first. Protein powder. It's not a mandatory supplement, but it is super useful. This is less of a supplement and more of a tool. Here's why it's helpful for women over 40. Hitting protein gets harder with appetite changes, busy schedules, and perimenopause chaos. So protein supports muscle retention, metabolism, and satiety, and recovery. It is best used to close the gap, not to replace meals all day. So some great times are breakfast when you're not hungry, post-workout, or afternoon snack danger zones when you're inhaling everything in sight. You want to look for a protein that offers you 25 to 30 grams per serving with minimal fillers and that has had third-party testing. Whey isolate is the easiest. It's got high leucine, which is best for muscle building, and lower lactose. Casein is slower digestion, good at night. Plant blend like a pea rice blend is great option, but check the total protein and amino acid profile. The last supplement, which has been controversial in the past, but which is creatine monohydrate. It is getting hyped because it actually earns it. And why it matters for women 40 plus is because it helps muscles produce quick energy, ATP, and it supports strength, power, training performance. It supports lean mass retention when it's paired with strength training. Growing research shows its interest for brain health, cognitive support, resilience under stress, and overall function. How you're going to take the creatine monohydrate is you're going to take 3 to 5 grams daily, including rest days. Timing, it doesn't matter much, but consistency does. So you can mix it in your water, your coffee, your smoothie, whatever way is the easiest way to get it. Loading isn't necessary. You can load, but most women do great with steady daily dosing. A common concern is, will I gain weight? And some people hold a little extra water in the muscle. It's not fat. Many women notice better fullness, more improved strength, not bulk. If there's a kidney disease history or you're on medicine affecting your kidneys, you need to consult your doctor first. So what's usually overhyped and you want to save your money on are menopause blends like hormone teas, supplements with vague proprietary formulas. Don't waste your money on fat burners. Green powders are fine, but they're not a vegetable replacement. Collagen as your protein, it can support your skin, joints for some, but it's not a complete muscle building protein. That's a big common misconception. Pre-workouts, most of the effect is caffeine and the rest is due to expensive fairy dust. If you want a simple pre-work, coffee and electrolytes covers a lot. You want to look for an NSF certified for sport or other third-party testing when possible. If a woman over 40 wants the simplest, most effective starting point, vitamin D3, dose based on labs if possible. Magnesium glycinate at night, omega-3, or eat fatty fish a couple of times a week. Creatine, monohydrate, 3 to 5 grams daily. Protein powder, only if you struggle to hit protein. Then you can always reassess after 30 days based on your energy, your sleep, your training, digestion, labs. Ladies over 40, follow for more healthy tips.